If we can't receive what we need within the public health system, what should patients do? And if it can be offered through private care, is it not far better to get it there rather than have somebody perhaps be gravely ill or die on a wait list?
Canadian patient Joan Hama nearly died because of long waiting lists in the healthcare system. SecondStreet.org sat down with her to hear her story.
I'm Joan Hama, and I've lived in West Kelowna for the past 15 years. I work as a financial planner for one of the major banks here in Canada, and I've been with them for about 43 years now. And in my spare time, I like to do some golfing, play some softball, and outdoor activities like fishing. My story began really as I thought was a positive thing. I went for a physical. I was getting close to retirement, so I thought I should make sure I'm healthy before I retire. So I thought I'd just get a full physical with my doctor. And she recommended that as part of it, I go through the colon cancer screening program. And that's how it all started.
Back in July 2016, when the story took place, the government's guidelines called for Joan to have a colonoscopy within 8 weeks. However, she ended up waiting nearly double that time when her colon ruptured. Joan nearly died because of the government's long waiting lists.
That morning, I knew something was wrong. I was in terrible pain. The medical clinic where my doctor is only a couple blocks away, so I drove there, found out they don't open till 7:30, and that's when I decided to drive myself to emergency at Kelowna General Hospital.
Over the next 15 days, Joan had a horrendous experience in the ICU and hospital. Doctors found a tumor in her large intestine, which caused her bowel to perforate and led to a severe sepsis infection. Joan required resuscitation several times because of this. Her husband even had family members ready to say their goodbyes.
So after the chemotherapy and that, I started reading about wait times for colonoscopies and found out quite a bit of information. I was astounded that Vernon Jubilee only had a 4 to 6 week wait time, and Kelowna General at that time was 8 months. That response from the patient review board actually made me angry that Interior Health had nothing in place to perhaps offered alternatives, whether it be another hospital, whether it be private, whatever, so that I wouldn't have had to go through this ordeal.
There are a few important takeaways from Joan's experience. First, she was not presented with a choice. She lived in West Kelowna and was told she would have to wait about 32 weeks for colonoscopy. However, just an hour down the road in Vernon, the wait time was about 6 weeks. Joan gladly would have gone to that hospital in the first place, but no one offered her that option. Second, Canada could reduce wait times by copying better performing healthcare systems in other countries. Instead of blocking private healthcare like Canadian governments do, they give patients a choice between using the public system or private options. As some patients decide to use private options, there is less pressure on their public system. Right now, the BC government is in court trying to prohibit patients from using private clinics. Joan is supporting a legal challenge by the Canby Surgical Clinic in Vancouver to allow patients a choice between public and private options. Finally, Joan was lucky that she didn't die because of her long wait, but many patients do. SecondStreet.org has gathered government data showing nearly 27,000 patients have died while waiting for various surgeries, diagnostic scans, and appointments with specialists since 2018.
With joining the Canby Surgical Centre in their appeal, I provided an affidavit as far as my ordeal, but also my surgeon provided an affidavit as well. And that's where I found out it was his opinion that if I had the colonoscopy within the 8-week time period that they recommend, he is of the opinion that I wouldn't have had to go through any of what I did. And he thinks there would have been very little risk at that time.
You can learn more about healthcare reform options at secondstreet.org.